and the commitment to it will not negate its deep flaws. The only way to achieve the goals we all share is to begin by repealing this failed law so we can replace it with a plan that works. I hope we can. I yield the floor. Suggest absence of a quorum.
Clerk will call the roll.
Mr. Alexander.
Madam President,
Senator from Alabama.
I would ask consent that the quorum call be dispensed with.
Without objection.
Thank you. Madam President, I would like to share some remarks about the economic condition of American workers, the immigration bill that passed here recently, and in general about where we are as a nation and the difficulties we're facing. I think there is a growing acceptance by most experts that we have indeed seen a decline in wages of middle class and working Americans relative to inflation for maybe as much as 1999. A steady erosion of their position incomes relative to the price of products that they buy. That is not a healthy trend. President Obama talked about it. Our Democratic colleagues talked about it when President Bush was president a lot, but it's continued. I thought maybe it was an aberration, but I don't think so anymore. I think a lot of things are happening with robotics, Obamacare, other things that are happening that are making it more difficult for workers to find jobs. Unemployment remains exceedingly high, and to have wage increases. So one of the things that I noticed this week from the Republican side of the aisle, Congress received 2 letters, one from Republican donors, according to some, and another from CEOs urging that Congress act on immigration. This is primarily to the House members. Give me a water. So nearly 100 top Republican donors, they call themselves, and Bush administration officials sent a letter to the House Republicans on Tuesday urging lawmakers to pass a bill that legalizes illegal immigrants. The donor letter came the same day. The United States Chamber of Commerce and 400 other businesses and umbrella groups fired off another letter to the House leaders of both parties urging them to pass something. One word was not mentioned in either one of those letters: wages. Nor was any discussion of jobs and unemployment raised in those letters. Mr. Karl Rove, a man I know and really like and a long-time friend, and these groups would have us believe that this legislation is just about the providing of amnesty to people who've been here a long time. And that's certainly a large part of it. Businesses know that legalizing illegal workers will indeed expand the available labor pool for industries with the effect, I suggest, of bringing down wages, particularly in the areas where illegal workers might have previously not had access. So of the 11 million people, perhaps half, we understand, do not have fake documents, aren't able to work in the labor force effectively, and they take marginal jobs. And if this bill were to pass, all would immediately be given Social Security numbers and able to apply to any job in America. And that's both a good thing and a difficult thing. It's good that they could be able to work. It's not so good if you wanted one of the jobs that would be taken. But there is a phrase in the letter which has gotten too little attention and which explains what this really is all about. Mr. Robe and the donors say the legislation must, quote, provide a legal way for U.S.-based companies to hire the workers they need, close quote. So we are supposed to pass a law that guarantees American workers the right to hire whoever they need, whoever they say they need, whoever they believe is best for them. And that means the best worker at the lowest price. That's what free markets are all about. That's what the law of supply and demand is all about. And it has not been repealed, by the way. So first and foremost, that cannot be the goal of an immigration policy of the United States of America. It cannot be the overriding policy of our system to provide and to make sure that whatever workers our companies want at whatever price apparently they're willing to pay, want to pay, we just allow workers to come in from abroad and take those jobs regardless of the unemployment rate in America, regardless of the number of people that are on welfare, on unemployment compensation, who haven't had a good paycheck in a number of years, perhaps. Our responsibility and our goal is to serve the people of this country and to try to create a climate and an economic agenda that allows them to prosper and to actually find jobs and actually get pay raises, not pay reductions. Of course, there's already a legal way for U.S.-based companies to hire workers they need. They can hire the people living here today that are unemployed. Or they can hire some of the million-plus immigrants that we lawfully admit each year. We have a very generous immigration policy. No one is talking about ending that and not allowing immigration to continue. We allow about 1.1 million a year come to America lawfully, plus guest workers who come specifically to work. That's very generous. But this bill would double the number of guest workers and increase substantially the number of people who come through immigration to become permanent residents in our country at a time of high unemployment, much higher unemployment than we had in 2007. And that bill would have allowed much fewer people to come into the country. And it was rejected by the American people. So no one is saying that these programs can't and shouldn't exist and that they shouldn't be improved. But I'm afraid the businesses want really just the choicest pick of labor at the lowest cost they can get it. That's what businesses do. That's what businesses want every day. When they go out and interview people, they go out and interview people. They want the best person they can get at the least cost. That's what their stockholders demand. And so they believe the immigration policy for the entire nation should exist to create an abundance of low-cost labor. I don't agree with that. They, in their bubble that they live in, think that lower wages are good. You hear about their concerns over rising wages might drive up prices, you hear the Wall Street Journal say. Well, maybe some politicians think that way too. They're not concerned with how the plan impacts workers, the immigrants themselves, public resources, the education system, or taxpayers' dollars. They're not focused on the broader economic and social concerns that happen when someone is not able to get a job for years at a decent wage. The focus tends to be on the reduction of the cost of labor. But America has a larger concern. That concern is unemployment, it is workplace participation, it's wages, and it's the cost of social services to those in need. We all agree we must make America more competitive globally. Workers must be productive and competitive. But how do we close the income gap? How do we deal with that? The best way to do that is not to reduce our wages and workers' quality of life. The way to do that is with a less burdensome tax code, a less intrusive regulatory system, and a tougher, smarter fair trade policy. And these policies would make us more competitive and help wages and working conditions improve. So when these businesses' voices and establishment figures say their GOP needs to support a comprehensive immigration bill, what they're really saying is that GOP and the Congress of both parties, which in the Senate, of course, a minority of Republicans voted for the bill and every single Democrat voted for the bill. They would have done the things I'm concerned about. So now they're worried about the Republican House and they're trying to put the pressure on them. So what they're saying is we need to increase low-skill immigration when we don't have enough jobs now. The Senate bill, based on CBO analysis, would provide legal status to 46 million people, mostly lower-skilled immigrants by 2023, 46 million. Here's what the National Review editorialized on the subject, quote, by more than doubling the number of so-called guest workers admitted each year, the bill would help create a permanent underclass of foreign workers. The 2007 Bush-Kennedy proposal was rejected in part because it would have added 125,000 new guest workers. The Gang of Eight bill, one that we just passed in the Senate, would have added 1.6 million the first year and about 600,000 a year after that, and that is on top of a 50% or more increase in the total level of legal immigration. The creation of a large population of second-class workers is undesirable from the point of view of the American national interest, which should be our guiding force in this matter. The United States is a nation with an economy, not an economy with a nation. This nation owes certain things to its citizens, the people who are here now. And we've got a lot, 300 million, and many of them are hurting, and we owe them the best opportunity, to be successful and have a decent job with increasing wages, not declining. Here's what conservative writer Yuval Levin wrote in a recent op-ed. I'm saying this because these are conservative writers. The left's economic policies and the legacy of decades of right-wing confusion about the difference between being pro-market and being pro-business are making the American economy less and less like a vision of capitalism that conservatives should want to defend. They should consider what now would be best for the cause of growth and prosperity, the cause of free markets and free people. Capitalism is fundamentally democratic, after all. We might say fundamentally populist. Recovering this understanding of conservative economics would help today's Republicans see an enormous public need and an important political opportunity. It would point to a conservative agenda to help working families better afford life in the middle class and give more Americans a chance to rise. Close quote. So this is, I guess, directed, too late now, to deal with the Senate. It's passed the Senate, but not too late to deal with the House, which does have a Republican majority. So if members of Congress want to broaden their appeal, the answer lies in speaking to the real and legitimate concerns of millions of hurting Americans whose wages have declined and whose job prospects have diminished. In 2000, the New York Times talked about this in 2000. They forgot about all this now. But in 2000, they editorialized against an amnesty bill, what they call a hasty call for amnesty, and warned that, quote, between about 1980 and 1995, the gap between wages of high school dropouts and all other workers widened substantially. Well, that's what the New York Times said then, and it remains true. Professor George Borjas, himself an immigrant to America as a young man from Cuba, now at Harvard, perhaps the most effective and knowledgeable and respected student of wages and immigration in the world, certainly in the United States, estimates, get this, that 40%, almost half of the trend downward in wages today can be traced to immigration from unskilled workers, because it provides businesses don't have to bid up salaries to get good workers if you constantly have a flow of people come in. And now that data, he reported, has been updated. High levels of low-skilled immigration between 1980 and 2000, which would be greatly increased if this bill that passed the Senate were to become law, has already reduced the wages of native workers without a high school diploma by 8%, according to Professor Borjas. He's done Labor Department of Statistics, census data, and all kinds of data according to the highest academic standards. He said their wages have fallen from 1980 to 2000 by 8% in real dollars as a result of the current flow of immigration. And so that is about $260 a month. You think that doesn't make a difference to a working American and their family to lose $260 a month? Oh, we don't talk about that. That's not a problem. The immigration bill will increase wages, we're told. Professor Borjas says it's already reduced wages by enough to be very painful to people that are trying to take care of their families today. And wages continue to fall, and this is not only an economic problem, but it's a social problem. The idea that dramatically increasing the number of foreign workers to take a limited number of American jobs will reduce unemployment and raise wages is so ridiculous, it's hard to think it worth discussion. The very idea of this is beyond my comprehension. Yet we have the President out there today sending out documents claiming just the opposite. The President of the United States. The law of supply and demand has not been reduced and eliminated. Wages today are lower than in 1999. Median household income has declined 8% in that time. 47 million of our residents are on food stamps today. 1 in 3 households in Detroit. According to the Associated Press, 4 out of 5 U.S. adults struggle with joblessness, near poverty, or reliance on welfare. There is no shortage of labor in the United States. There is a shortage of jobs in the United States. Our goal must be to help our struggling Americans move from dependency to independence, to help them find steady jobs and rising pay, not declining pay. Our policy cannot be to simply relegate more and more of our citizens to dependence on the government while importing a steady stream of foreign workers to take the available jobs. That is not in the interest of our country or the people of this country. Some contend our unemployed don't have the needed skills. Well, let's train them. We now spend over $750 billion a year on means-tested welfare assistance-type programs. That's the largest item in the budget, bigger than Social Security, bigger than defense, bigger than Medicare. And of that amount, we spend about, for every dollar we spend on those programs, for every $100 we spend on those programs, we only spend $1 on job training. So we need to wake up here. We need to quit paying people not to work, quit delivering money that creates dependence, and be shifting our policies in a way that puts people to work and get them trained to take the jobs that are here today. As we leave for recess, my message to my colleagues in the House is this: just do the right thing. Make your priority restoring the rule of law, defending working Americans, and helping those struggling, immigrant and native-born. So people immigrate here lawfully. They want to go to work here and see their wages rise too. Their wages are being pulled down if the flow of immigration is too large. So it's amazing to me how the coalition has been put together. And some of the comments about it are kind of take my breath away. Here's what the President said today in his paper, claiming that everything is going to be great with this huge increase of immigration that was in the bill and he wants to see passed in the House. This is their report. The broader leisure and hospitality industries, one of the fastest growing sectors in the United States economy, also stands to benefit significantly from common sense immigration reform. According to the Bureau of Labor Statistics, the leisure and hospitality industry has consistently added jobs over the last 3 years. These sectors remain a source of robust economic activity and continue to exceed expectations. Leaders of these industries have been long-time proponents of legislation that would legalize workers in the United States and facilitate the lawful employment of future foreign-born workers. The head of the American Hotel and Lodging Association this year applauded the Senate, I bet he did, applauded the Senate on behalf of the lodging industry for its bipartisan commitment to immigration reform that creates jobs, boosts travel and tourism, preserve hoteliers' access to a strong seasonal workforce, and stimulates economic growth, close quote. Well, sure. He'd rather be able to have a large flow of workers from abroad take the jobs. Well, what happens if Americans are not getting jobs? Are they on the food stamp rolls, the assistance rolls? Are they on unemployment compensation? Are they otherwise struggling to get by with government assistance? Wouldn't they be better for our Americans to have those jobs? I mean, think about it. The President of the United States out here celebrating special interest hotel magnates, casino magnates who want cheap foreign labor so they don't have to hire American workers who are unemployed. Now, that's what we're talking about. Well, I think it's time for the Republicans to stand up to the Republican 100 donors writing their letter. Give me a break. And reject their advice and the premise of their letter that the public policy of the United States should be based on giving U.S. companies a legal basis for hiring all the low-cost foreign workers they say they need. They're not entitled to demand that. We're supposed to set national policy here. We're supposed to set policy that serves the national interest. We don't work for these people. So the national interest is to reduce unemployment, certainly, and to create rising wages. And that's our responsibility in this body, and let's get on with it. And I just want to say how great it is to see my friend Senator Enzi. I'm taking his time up. I hope I haven't kept him too late, but he works late anyway. But he's been a great principal supporter of immigration reform and has opposed the bill that came before us. And I thank you, Senator Enzi, for your work on so many issues, but this one's on my mind today, and it's great to see you. I would yield the floor and note the absence of a quorum.
Clerk will call the roll. Mr. Alexander.
President.
Senator from Wyoming.
Madam President, I'd ask that the quorum call be set aside.
Without objection.
Thank you. You know, a lot of Americans are worried right now about their health insurance. They know what's coming. Seniors have been turned down by their doctor for Medicare treatment because the doctors aren't adequately compensated. If they haven't been turned down, they know someone who has been turned down. And Medicaid is uncertain and a stigma. On the one hand, advances in medical technology and the capabilities and knowledge of our health care providers means that we are living longer and have more tools at hand than ever before to address diseases and illnesses. However, on the other hand, this increasing life expectancy, coupled with the aging of our population and the steady increases in health care costs, means that our health care system is on the verge of becoming completely unsustainable financially. All across the country, health insurance rates are skyrocketing. Families are struggling to cope with the higher costs and less choice. Employees are losing coverage, and they're losing working hours, and businesses just aren't hiring. At the center of this uncertainty is the President's health care law. A number of provisions have already gone into effect, but we won't experience the full force of the law until 2014. That's January. The Democrat go-it-alone health care reform plan in 2009 was the first major piece of legislation to pass Congress without a bipartisan vote. Let me repeat that again. The Democrat go-it-alone health care reform plan in 2009 was the first major piece of legislation to pass Congress without a bipartisan vote. When you have a partisan bill, you get partisan results. After 20,000 pages of regulations, and still a lot more to come, they're a little behind on those, and after over 150 new bureaucratic boards, agencies, and programs, the federal government still can't figure out how to make the law work and have had to delay it, in part. What I have seen to date is enough to convince me that we need a different path. I opposed the health care law initially, and I support full repeal of the law. Fixing our health care system doesn't have to be divisive or partisan. There are clear differences in the approach to fixing health care from all across the political ideological spectrum. However, the least we have to do is to dismantle the worst parts of the law and replace them with reforms that actually work. Reforms that lower cost and expand choice. Reforms that don't bankrupt the country and every taxpayer. The federal government needs to support viable solutions when needed and refrain from handcuffing innovative private designs with the excessive regulations or narrowed political interests. We need more competition, not less. Unless we take concrete steps now, we will soon be unable to switch off the track towards government-run health care. When I first got here, I was warned that there were people that didn't care who ran the train of health as long as it wrecked. And then we could have universal, single-pay, government-run health care. I'm not sure that isn't still the goal. One clear example of how convoluted this law is comes from the definition of who an employee is. Now, I used to work in the shoe business, so I understand the difference between full-time work, which was 40 hours a week, and part-time work, which was under 40 hours a week. However, under the health care law, there are now full-time employees and full-time equivalents. What this means is that the law requires employers, and particularly small businesses, to determine how many of their part-time employees it takes to equal a full-time employee. You don't come under the full force of the law until you hit 50 employees. And there are businesses that understand that, and they're trying to avoid getting to that 50th employee. But there's some catches in this law. First of all, the health care law sets full-time at 30 hours. Not 40 hours per week, 30 hours. It was news to me, it always was 40 hours. Second, the law requires these employers to take everyone working 29 hours a week or less, combine all of their time for a week, and then divide by the number 30 to establish how many full-time equivalents these part-time workers represent. I don't think a lot of people have planned on that. If you're still following along at this point, congratulations. You can see how costly the taxes imposed by this law will be. What if the rule forces you to add all your employees' hours and divide by 30 hours to determine your full-time employees? What if you have 10 employees who are working 40 hours? That'd be 400 hours. So you divide that by 30, and you now find out that you're paying 10 people, but you've actually got 13 1/3 employees at the full-time requirement. That could put you over the 50 and put you into a whole other category of costs and penalties. Now, if you have 10 employees and you watched it so that they're only at the 29 hours, that comes to 290 hours, and if you divide that by 30, you'll find out that even though none of these people are full-time employees, that you really have 9 2/3 full-time employees. You can see how they could do a little miscalculation and suddenly be at the 50 and be into a whole new series of penalties. The Obama administration also had to admit recently that the employer mandate, one of the key pieces of the law, isn't ready. Now one of the most economically crushing and burdensome regulations won't be implemented until past 2014, past the 2014 election in 2015. I don't think that was a mistake on their part. I think it was intentional. Come after the election. Now, there's another little complication that gets thrown in here, though. If those employers are not providing the health insurance and not being fined for not being the health insurance, then the people that work for them have to go on the exchange to get their health insurance. And if they go on the exchange to get their health insurance, they can't be subsidized by the business that they worked for. That's going to be a surprise to a lot of employees, too. So the delay will force more people to enroll in health care exchanges or face the tax penalty if they don't. Now, a lot of people don't realize that if they do go on the exchange, there's also a surcharge on the cost of their health insurance. They're going to be paying a 3.5% tax for buying the insurance. And, of course, if they don't buy the insurance, then they get a penalty. So the delay was also made for the businesses without congressional approval, done administratively. The Congressional Budget Office and the Joint Committee on Taxation informed Senator Hatch this week that this delay will increase the cost of the new insurance program established by law by $12 billion. It's not like we had an extra $12 billion laying around here. And in particular, the Congressional Budget Office and the Joint Committee on Taxation estimated that the federal government would be required to pay an additional $3 billion in subsidies for people on the exchanges. A lot of extra costs just got kicked in there. This delay not only increases the costs on hardworking Americans, but it fails the original intent of health care reform. That's to provide Americans with high-quality, affordable health care. In addition, the law requires the administration to set up health insurance exchanges in a number of states, including Wyoming. We're sparsely populated, low numbers. The numbers wouldn't work out to do our own exchange. One problem is that the administration has yet to tell anyone exactly how they're going to do those exchanges or what even a basic plan is. Now, if you're going to have a range of plans that insurance companies can bid on that you can look up on the computer, doesn't it seem before you can even start that you'd have to know what the basic plan is? How the President can argue that everyone will love the health care law once it goes into effect is beyond me. This administration can't even tell anyone where they can buy their insurance, what plan options will be available, and most importantly, what the cost will be. Remember what Nancy Pelosi said before they passed the law, that we'll have to pass the bill before we get to know what's in it. The administration is shopping its own version of that statement. As the Senate Finance Committee chairman put it recently, this law is a train wreck waiting to happen. That's the Democrat Senate Finance Committee chairman. Of course, on top of all this, the law relies in part on new taxes and tax subsidies to support the coverage expansion. This means that the IRS will be involved in implementation. I have significant concerns with the ability of the IRS, particularly in wake of the current scandal. The fact that this organization, the IRS, tainted by such political behavior, is involved in implementing the new health care law has increased my belief that the health care law is not something the country wants or needs. And of course, the IRS employees don't want to come under this law either. I don't know of anybody that really wants to come under it. I'll take a close look at proposals to remove the IRS from any implementation activities, but I do think they should be subject to the law too. At the same time, I'll continue to work to provide folks with relief from the health care law as a whole. Now, one of the things they said, if you're going on the exchange, if you're in certain income categories, then you get a subsidy from the government to help you purchase your insurance. And we're told now that that will be self-reporting and will not be subject to audit. Doesn't that sound like something that could be fraught with a lot of fraud, where you can say that you just make enough to get into the biggest subsidies? Everybody wouldn't do that, of course, but I think there are some that would. Now, how's the government doing on some of the things they already put into effect? I saw a little article on high-risk pools. When the bill went in, a lot of the states already had high-risk pools, and we work with those states to make those viable. But the government, the federal government, said we can do it for less. And they put in a high-risk pool. Now, to keep people from jumping from the state ones, which, yes, are more expensive, over into the federal one, which is less expensive, they said that you couldn't make the jump unless you were without insurance for 6 months. Now, people that need to be in the high-risk pool can't afford to be without insurance for 6 months. So there wasn't a big jump to the high-risk pool. But in spite of the fact that there wasn't a big jump to the high-risk pool, the federal high-risk pool went broke. It ran out of money. And here's the disturbing part of that article. They said, well, they just shift that cost over to the states. The states are already doing it, and they're doing the right thing, and now they're going to be asked to pick up the additional costs. How many parts of Obamacare are going to get shifted over to the states? The states have had a lot of promises under this. Can any of those promises be met? Will they be met? A lot of decisions are being based on what the federal government promised, and of course, in truth, we're out of money. The new law also failed to address the problem of rising health care costs. I believe that the federal fiscal situation is untenable, and we need to implement significant and far-reaching spending cuts to get our fiscal house in order. We cannot continue on our current path. The President and his administration will argue that the new law will expand access and lower costs. While the law certainly increases access to insurance, it also moved billions of dollars from the Medicare program to pay for this new insurance program. That's not exactly saving the government money. The projections for lower costs also don't add up for the average American either. Insurance premiums and rates are increasing. Small businesses are unable to continue providing health insurance for their workers. Businesses in general have delayed hiring or are only hiring people part-time. Although I hope they listened to the part that I gave about the little part-time catch that's built into the law. All of these decisions are directly driven by the economic impact of the health care law. Now, my Senate Republican colleagues and I are focused on developing proposals that address the worst aspects of the health care law. The law increases premiums and health care costs, forces employers to stop offering insurance to their employees, and slashes benefits for millions of Medicare beneficiaries. I support repealing both the cap on health savings accounts and on flexible spending accounts, and the prohibition on over-the-counter purchases included in health care law. Flexible spending accounts help make consumers more aware and engaged in their health care spending. Health savings accounts are something that young, healthy staffers of the Senate like to do. They could do the math real easy. They could look at the regular program and see how much that would cost, or they could take a look at health savings accounts. And the difference in the price, in just 3 years, they could cover the whole deductible part as long as they were healthy for 3 years, and they'd be covered for that part until something major happened, and they were covered for catastrophic. So they found that to be a real bargain, but not anymore. Now, additionally, a number of other senators and I have put forth bills to repeal the taxes imposed by the President's health care law. That would be relief from new taxes on prescription drugs, relief from new taxes on medical devices, relief from new taxes on health insurance plans. I want to provide relief to employers from the new regulations imposed on them by the law. These ideas preserve competition in a private market for health care coverage and lower the cost of care for the consumer. All of these steps are common sense reforms to the health care law that take us off the path toward a national federal health care system. One of the most effective ways Congress can address the rising costs of health care is to focus on the way it's delivered as part of the nation's current cost-driven and ineffective patient care system. America's broken fee-for-service structure is driving our nation's health care system further downward. Today's method of payment encourages providers to see as many patients and prescribe as many treatments as possible, but does nothing to reward providers who keep patients healthy. This maligned incentives created for the fee-for-service system drive up costs and hurt patient care. Tackling this issue is a good start to reining in rising health care costs. Now, the health care law championed by President Obama and the majority party in the Senate did little to address these problems because the vast majority of the legislation involved a massive expansion of the government price controls found in the fee-for-service Medicare and Medicaid. If we want to address the threat posed by out-of-control entitlement spending, we need to restructure Medicare to better align incentives for providers and beneficiaries. This will not only lower health care costs, it will also improve the quality of care for millions of Americans. It's very important that we protect access to rural health care services, too. There's more that can be done to better align federal programs to meet the needs of rural and frontier states. The criteria that determine eligibility for federal funds to support rural health care programs are based on factors that make it difficult to prove the needs of the underserved in rural and frontier areas. For example, one provider per 3,500 people in New York City is entirely different than the 3,500 people living in Fremont or Campbell County, or perhaps more so in Niobrara County. I use Niobrara County quite a bit for examples because Niobrara County is the size of Delaware and has 2,500 people living in it. So it's 90 miles tall and 75 miles wide, and near the bottom in the center is a town called Lusk, and that's where almost all the people live. And they do have a hospital there. And when they have a doctor or a physician's assistant, the hospital is open. When it's not, they're 104 miles from trauma center. And you can't apply the same rules to that hospital that you apply to New York City's hospital. In addition, we need to think more creatively about how to use technology services to improve telemedicine capabilities, particularly for the rural places, so that where a person lives has less impact on the level of care that they're able to receive. The advancement of more powerful wireless technologies has substantial potential to remotely link individuals across the country to deliver health care in more accessible settings. Our nation has made great strides in improving the quality of life for all Americans, and we need to remember that every major legislative initiative that has helped transform our country has been forged in the spirit of cooperation. These qualities are essential to the success and longevity of crucial programs such as Medicare and Medicaid. But when it comes to health care decisions being made in Washington lately, the only thing the government is doing well is increasing partisanship and legislative gridlock. The President and Democrats need to listen. It's time to admit that this partisan experiment in government-run health care is failing. In order for this to get better, they must acknowledge the problem. Some of the law's authors and biggest supporters admit this law is a mess and it'll only get worse. However, those in the Democratic leadership continue to support flawed health care laws out of pride, politics, or a belief that the government knows best. It makes no sense to stubbornly cling to a law that's so massive, burdensome, bureaucratic, and confusing that it's collapsing under its own weight. By focusing on positive changes, Congress can give the failed law's proponents a way out. The key is finding common ground. More often than not, the country hears about what divides Congress and not what unifies us. We could come together. We could focus on common-sense solutions with the kind of step-by-step reforms that would protect Americans. I believe members of Congress on both sides of the aisle can agree on 80% of an issue 100% of the time. I want to be clear, this isn't compromise. When you compromise, each side gives up something they believe in, and in the end, they get something that no one believes in. I'm about agreeing on common ground without compromise, without sacrificing each party's principles, by leaving out the parts of the issue to look for a solution later. Congress also needs to stop deal-making and start legislating. We need to stop developing comprehensive bills and then market them as the only option. Comprehensive means, to me, incomprehensible. The larger a bill is, the harder it is to agree. Of course, you can tuck some things in there that people will never see. This is especially true when we pass a bill that no one has fully read and then afterwards has to find out what's in it. No party has all the good ideas. By working together, the end result should be something that not only works but moves the country forward in a responsible way. We still need health care reform, but it has to be the right way, with strong bipartisan support on individual health care issues. What happened to individual choice on a policy? What happened to liability reform? What about sale of insurance across state lines or pooling through an association so they have leverage against the insurance companies? What happened to adequate compensation for providers? All of those things have been left out. Providing Americans with access to affordable health care at a high quality is something the Republicans and Democrats should be able to agree upon. The challenges of the American health care system are not going away. If we improve health care in a practical instead of a political way, we can make things better. Good policy is good politics. And why do I have some hope that this is going to happen? Congress is more interested now than they have ever been. And the reason is there was a Republican, yes, there was one Republican provision in the bill. And that's one that forced Congress to go into the exchanges too. We and our staffs have to live under the law we passed. That's how it should be. But the result is hitting everyone in their offices right now. Every senator, every representative, as they look what may happen to their staff on January 1st, and their staffs are concerned. It has changed the tenor of some of the hearings that we're having. It's pretty hard hitting on both sides. So with that, I do have hope, and I yield the floor.
Madam President.
The senator from Delaware.
Thank you, Madam President. Most of our colleagues have finished up. A lot of them have packed up, and they're heading back for their home states to begin the August recess. And I wish them all well, especially the one who just preceded me on the floor here tonight. I stand between, for the staff here and Pages, who are wrapping up their summer with us, at least a month with us. They'll be heading back to their home states across America. We had one of our Pages, a Page actually in the last group at the beginning of the summer from Delaware. We're very proud of her and all the ones that have been here. I told them that they're about maybe the best group we've ever had. So
reply to them. Even that guy from Arkansas that you know, whose mom used to sit right down here on the road next to Mark Pryor and me. I want to thank the staff for their hard work for the course of this year. We're at a good place, I think, and the Senate's starting to act more like the Senate of old. And we're beginning to govern a little more from the center, and Democrats and Republicans to looking and finding ways to work together on a wide range of issues. Especially pleased with the progress we made on federal student loan program, and again trying to make sure the program's available at a reasonable interest rate cost to help make sure that a lot of students, young and old, can, if they need the help, sign up for student loans this late this summer and this fall, and be able to go back to school and complete their education. Senator Renzi used the numbers 80-20, and he is, in the times that the years that I've known him, has talked about the 80-20 rule, which he may be the architect of. Madam President, the 80-20 rule is something like this. Around here we agree on about 80% of the stuff. We may disagree on 20% of the stuff, but at the end, why don't we just focus on the 80% we agree on? Set aside the 20% we don't agree on, and we'll take that up another day. That is the spirit that Senator Tom Coburn, who's the ranking Republican on the Senate Homeland Security and Government Affairs Committee, and I have taken to an issue that needs to be addressed, and that is a path forward to make sure that we're going to have a strong postal system in this country. We had for over 200 years, and we need to have a strong and vibrant, financially strong, sustainable postal system for a long time, for as long as we're going to be a country. The nature of our needs, the way we communicate, have changed dramatically. I remember finding in my parents' home, oh gosh, about 5-6 years ago, when after my dad had died, my mom was going to move out of their home in Florida up to close to my sister in Kentucky. We found this treasure trove of love letters that my parents exchanged in World War II. And for others of you whose parents have maybe been in a similar situation, whose folks were part of the Great Generation, you may have uncovered a treasure trove of letters like that as well. They wrote literally every day, just about every day through the war. I remember the happiest days that I spent in Southeast Asia, several tours that I served back there in the early 70s. Happiest days for us during each week were the day or days we got the mail. Those are the best days. Letters from home. Cards, postcards, newspapers, magazines, those are great days. And people over in Afghanistan, our troops in Afghanistan, they still get mail, they still get letters, they still get postcards, they get birthday cards and Father's Day cards, Mother's Day cards, but it's different because they have Skype, they have cell phones, they have a lot of other ways to communicate. I'd asked my staff recently, Madam President, asked them to actually go back 12 years ago when I first came here. And I said, tell me how many emails we got for every letter that we sent. Tell me how many emails we got for every letter that we sent and received. And as it turned out, for every one email that we received 10 or 12 letters. That was just like 10, 12 years ago. I asked them to tell me what it is today, and it's just flipped. It's just the opposite. For every letter that we get, we receive roughly 10 or 12 emails. Now, the way we communicate in this country has changed. And that's just one clear example of it for us here on Capitol Hill. The Postal Service has struggled, much like the U.S. auto industry did in the last decade or two, to try to make a go of it. And the auto industry found themselves in a situation where they had more plants than they need, they had more suppliers than they need. They had really, in some ways, more different models than they needed. And they had, sadly, more employees than they needed, given their market share, which was about 85% when I was in Southeast Asia, and it dropped to about 45% 3-4 years ago. Fortunately, the auto industry here in this country is revived and vibrant and coming back. They're hiring, building cars, award-winning cars, highly energy-efficient cars. But it's an industry that's had to retool itself, to right-size itself for the 21st century. And they have done that, and they've done it well. The big three in the U.S. are back. They're building some of the best cars in the world. We can be proud of the work that they do. And they're not hiring people, hiring more people, paying bonuses to their employees. And it's turned out to be a very good successor. These were the companies that were literally going into bankruptcy. GM, Chrysler, not that many years ago. They're back, and we're a better country. Thank God we helped them get back. And Ford building great vehicles. What do we do about the Postal Service? The Postal Service is about 7 million people who work for the Postal Service or have jobs that relate to and are connected to directly or indirectly to the Postal Service. 7 million jobs. 7 million jobs. Well, what do we do about them? I think what we need to do, and what we're trying to do with the legislation that Dr. Coburn and I are introducing tonight, bipartisan legislation, we worked on it for the last 6 months. And I really want to thank him. I want to thank his staff, especially Chris Barkley, who's here on the floor with us, who's worked very closely and hard with John Kilvington, who's a member of the majority staff on Homeland Security and Government Affairs. I really want to thank them and a lot of other people in our staff, Democrat and Republican staff, majority and minority staff, for the terrific work they've done to try to find the middle, to focus on that 80% that we can agree on, 20% that we can't agree on, we'll put it off to another day. And the legislation that we've written, put simply, is that how do we make possible and ensure that this Postal Service, which is literally spelled out, called for in our Constitution all those years ago, is still relevant today, able to be financially viable today, meet our communications, help meet our communications needs today in a different age, in a digital age. And they can do this. They can do this. And there's a lot in the legislation that will help make that possible. We have not written a perfect bill. The ones that I've ever written or co-authored or authored, believe me, they're not perfect. We do our best, and then we introduce the legislation, and we ask other people who have similar or different views to tell us what they like about our legislation and what they don't like. And we, in introducing this legislation, we would just invite folks from around the country, where they happen to be residents, consumers, people who live in homes, families that rely on the mail, where they happen to be businesses that use the mail broadly, where they happen to be folks who send out magazines or catalogs or other nonprofit groups or other folks, or the folks who work for the Postal Service, the customers of the Postal Service, the employees, the retirees. We welcome your input. As you have a chance to look over what we've written, we ask you to see if you can help us make it better. Over in the House of Representatives, Congressman Issa, Congressman Cummings have been working along with their colleagues on legislation that's been reported out of committee over there, I think on a party line vote. And one of the things that I think is really important about our work here, I wanted very much for us to write a bipartisan bill. And Dr. Coburn wanted us to write a bipartisan bill. Neither one of us have gotten everything we want. The nature of compromise is there's some things you frankly aren't all that enamored with. And I think that's the case here. Our pledge going forward is to continue to work together, to ask Democrats and Republicans to help us improve on this legislation. The challenge for us is this: in a digital age, where people use Skype and Internet and Twitter and all, how do we enable the Postal Service to use what is truly unique? And that is a company, if you will, and they really are. It's a public-private company, but it's a big company. I think the second largest employer in the country. How do we enable them to use what is truly unique? And that is a business that goes to every mailbox in this country 5 or 6 days a week. How do we enable them to make a profit and to be financially sustainable and to meet some of our communications needs, and without huge ongoing reliance from taxpayers, from the Treasury, to do that? I think they can do it. I think they can do it. And I think the legislation that we've written will help make that possible. I want to say a special thanks to a number of folks. We want to thank the Postal Service, led by Pat Donahue, their Postmaster General, the Board of Governors there, the folks who are part of the Postal Service, the folks who represent hundreds of thousands of postal workers, or to the unions, to businesses across the country who use the Postal Service, who rely on the Postal Service, and a lot of customers, just regular people, who have given us their ideas and shared their ideas with us in towns large and small, cities and states large and small. We look forward to your input and your criticism, constructive we hope, to make this legislation even better. And again, I would say to our staffs who work so hard to get us to this point, a real special thank you. And to our colleagues on both sides of the aisle, we look forward to working with you to make what we think is a good bill even better. I like to say that everything I do, I know I can do better. The road to, if it isn't perfect, make it better. And my last thought on this was the road to improvement is always under construction. So we have some more work to do, and we're going to take, I think, towards a good bipartisan bill and hopefully make it a lot better. Madam President, With that, I think I'm going to say good night to you. Look forward to seeing you in about 5 weeks, and my best to you and the people that you so ably represent in New Hampshire. God bless. With that, I would note the absence of a quorum, and thanks so much.
Clerk will call the roll.
Mr. Alexander.